my name is Anna Marie Sinatra, the CEO of Sinatra Solutions, a coaching, consulting, and training firm that partners with you to catapult you to the next level in whatever it is that you're up to. Whether you're an individual that wants to sharpen your skills professionally, maybe it's leadership development, maybe you're the owner of a business and you have employees that you have to manage, maybe you're a manager, we can do that together. And if you're a business or an organization and you want to create those peaceful working atmospheres where your employees can work together as a team, we can do that with diversity training and conflict resolution and soft skill training. We can do it. We can partner together to get you where you want to be.
Hi, I'm Ava Sammarco, the practical nurse. I enjoy bringing you current and up-to-date health information for today's changing world. And I do this by hosting Health Focus.
And I host Health Matters.
And we collaborate to bring you Focus on Health Matters.
So before we get started, we want to thank some of our sponsors. We want to thank Mattress and More, where Maddie Mattress is educating us in a variety of ways on how to get a restful sleep. You could never believe there's so much information when you're looking for a new mattress. If you have problems getting a good night's sleep, maybe you have some injuries like I did, knowing all the different details about those mattresses is so important, and he's doing such a fine job in educating the community.
Go right to sleep.
Yeah.
Also, we'd like to thank Western New York Imaging Associates, Dr. Frank Mascaro, providing state-of-the-art imaging equipment to assist you in your time of need. With many locations throughout Western New York, Kenton MRI, Lockport MRI, and Western New York MRI, downtown Buffalo, and his equipment in several other facilities throughout Western New York. Yeah. You'd be surprised.
Yeah, you would be. He's like all over.
Wow.
Yep.
Great.
And we want to thank Joe DeMarco from Wings Flights of Hope, where his volunteer pilots are flying sick children and people all over the United States in their time of need, whether it's a transplant service or, somebody gets that call in the middle of the night. God knows if you had to call the airlines, you pay a fortune. They have volunteer pilots that stay on call waiting for you to call them. So without any further ado, you want to tell them about making sure they got those pens and papers.
Pens and papers.
So you take lots of notes and let's get started. And I am sitting here with Tony Lyons, who is the CEO of Western New York Medical Management, which was just right behind. We just came out the back door from Western New York Imaging Group and right into you're having like a whole park area here. This is pretty impressive. Yes.
Well, we're excited about the area downtown. Expanding. There's work going on across the street, building, but the location is. We're happy to be downtown. We think it's really best location in the area, and it's easy access downtown because we're right at the foot of the 33.
You know what I like about being downtown too, and the people in their everyday busy lives, they can come on their lunch hour or right after work. They don't have to worry about getting cross town somewhere. You're right here.
Yeah. So it's we're excited about opening the center. We anticipate having the Department of Health complete their survey at the end of this month. We're all ready for them, and that's. What more would you like to know about the
I'd like to know what you're going to be doing here so then our viewers are educated and know what you're doing here in case for their time of need.
Well, this is a single specialty freestanding ambulatory surgery center. We're being certified by the New York State Department of Health as an Article 28 facility, which means we're similar to hospitals and other freestanding facilities. We're regulated under their regulations, so it's a center that is of high quality. The single specialty is in pain management. They're minimally invasive pain management procedures that are an excellent alternative to over-the-counter medications, of course, but particularly prescription medications. And prescription medications definitely have their place in management of pain for patients. But as we all know, prescription medications has become a significant issue in this country,
Absolutely.
in this area, but in the across the country.
Yeah. And wouldn't you say it's true that we're educating our viewers all the time about you take medicine for one issue and then you'll have side effects from that medication?
Sure, yeah. And of course, some of the side effects of the opiates that are, effective for reducing pain can be serious for patients, because addiction is something that can happen to anyone with those serious drugs. So while they have their place for managing pain, these procedures put the physicians in a position where they can treat their patients, the pain management physicians, where they can treat their patients with a procedure that will go right to the nerves that cause the sensation of pain in their extremities, in their spine, and cauterize or desensitize those small nerves. The larger nerves in the back are more related to the motor functions that the people have, where the smaller nerves are the ones that the physicians expertly target and effectively reduce, or in some cases eliminate, pain. And it can be temporary. In some cases it can be longer term. And when I say temporary, I mean 3 to 8 months, and longer term.
That is so exciting.
It is. It really is.
That is really exciting.
It's also an alternative to again, surgical procedures to alleviate back pain is an essential medical treatment, but it sometimes can be avoided by these procedures as well, which is expensive and also much more invasive for patients. So it's an alternative there.
So someone who has a car accident, such as myself, and had all this stuff with my neck and shoulder and back, it's taken me years to recover because I've chosen not to use drugs or surgery. You're saying that in many cases, after you do your exam and history and all that, there may be some slight surgical procedures that can help reduce pain by going after these nerves in this area. See, we're getting this, folks. We're learning this together.
And the term slight is a good one, because it's as I said, it's a minimally invasive procedure, and these need to be done in a setting that is controlled and sterile, as the Department of Health requires us to be, and it's the physician uses a needle to go into the spine, and we have fluoroscopy, which is X-ray, and they watch where the needle goes in the spine so that they can pinpoint where it's supposed to be, and also make sure they don't hit something they shouldn't be hitting, with a blind injection. So we're under strict quality control, again, because of our status as a Department of Health approved program. And all of the physicians that will practice here are primarily, they're pain management physicians. And an individual will go to a pain management physician. They may be referred by a primary care physician or an orthopedic surgeon or others, and then that physician...
They would refer them to come here?
No.
Oh, okay, because they can walk in themselves?
No, there are no walk-ins to this.
Okay.
Like a hospital.
Okay.
You don't go into a hospital and say, I'd like some surgery. But rather you have a physician
that would be fun, wouldn't it?
that schedules your surgery, and then the physician meets you at the hospital and performs the surgery. It's the same thing here. The physician will meet you here, and because it's such a good location, not only for you but for your physician, and it's the accommodation. It's not a large hospital. It is specifically for this for these physicians and their patient population, to accommodate them, which we think is really a good thing. My background is hospitals, hospital administration. I love hospitals, but I've had procedures in hospitals as well. And I know the hospitals I've gone into that procedures.
Can I ask you some
can get
secret
lost in those
information?
places.
Not only that, but we're really trying to use our hospitals for what they're really meant to
Yeah.
be used for. So all these urgent care facilities and pain management and what you're doing here with Western New York Imaging Group as well, creating this whole area without some of the hospitals closing down. We really have to pay attention, folks. That's why I'm glad you've got those pens and papers and you're writing this information down, because times are changing. This just isn't the way things used to be.
Sure, yeah. I
Yeah.
agree.
Yeah, obviously you do. Well, I just thank you for allowing us to come in and see the facility, and we're going to be excited about coming back for your groundbreaking.
Yeah.
We're going to do a program so people can see all that happening there, and this is great information. We know you're not going to walk in. You're going to talk to your doctor about it. And anything else that you want to share that maybe we didn't get to yet, you want to make sure that our viewers have that information.
Well, I think that with the physicians that practice here, anyone who would like to know who those physicians are, we certainly can provide them a list of the physicians that practice here.
Are they on your
can be passed on.
website? Because we're showing your website, all your information. At
Our website isn't up yet.
Okay.
But the phone number that you provide for them, they can call and get that information. We can give them a list of the
Perfect.
physicians that practice here, and also, of course, they can get referred to them. They can ask for to be referred to them by their
Yes,
primary care
yes,
or
'cause
other physicians.
We have been talking a lot about that on this program, that when people go see their doctor, that you have your rights. You get to say where you want to go. I share that way before I even knew any of the doctors in this compound, this area. I live out in the South Towns, and my doctor was having me come to Western New York Imaging Associates because he has said this is where I want you to get. In his opinion, was the best imaging that was out there. So I came all the way in from the South Towns to get my imaging,
Right.
and so this is what we want you to know. And the other important thing is there's plenty of off-street parking,
Yes, there is. Yeah.
which is a really great benefit. So you don't have to pay for parking or get a ticket. So thank you again, Tony.
Well,
Appreciate
thank
it,
you.
and look forward to
Appreciate
seeing you
coming,
again
and
soon.
Yes, I look forward to it as well.
Thank you.
Thank you.
I found them. I found both Dr. Frank Mascaro and Dr. Joe Sergani. Thank you both so much once again. Your continued support to this community, especially now more than ever before with our hospitals closing down, your support and what you're doing. And what are we going to call this area? Like the Western New York Imaging Compound or Park or what? Because this is amazing here.
Thank you, Emery. Welcome back to Western New York MRI. And today's a real nice day to kind of talk about the new advances that we've made here at Western New York MRI by incorporating women's imaging. We've got,
which I have my arm in. What he's going to tell you what goes in there.
actually, this is our brand new digital mammography machine here from Hologic. It's state-of-the-art technology here, and we also across the hall have DEXA as well as ultrasound, so we can take care of women's imaging needs right here downtown Buffalo at Western New York MRI.
Wow, and plenty of parking too. That's why I don't want to forget to tell you folks, and sometimes I forget, and because that's such an issue when you come to downtown Buffalo. You can come on your lunch hour, you can come before work, after work. They have such a variety of hours servicing the community. You don't have to worry about getting across town to another place that closes at a certain hour, be caught up in rush hour traffic, and come right after work, have somewhere to park and get all your needs taken care of. Dr. Sergani, thank you so much for
Thank
taking,
you.
you guys are so busy. We appreciate you taking the time out.
Thank you, Anne-Marie, for coming here again today. And as you said, women can come at their lunch hour. This is digital, as Dr. Mascaro said. It's quick and it's fast. And we made the commitment for that process a few months ago before we put our 3 Tesla MRI, but we needed to wait till the construction phase is out, till the place is clean and safe and it's comfortable for the patients. But as soon as Jihan Memorial Hospital closed its doors, that was the only mammography around. And not only we replaced it with mammography at our site, we made sure that it is digital mammography. It is as state of the art. This is what the patients around us deserve, and that's what we're committed for.
And tell me why, and tell us so that we're learning more, why is digital so important?
Digital mammography studies have shown is higher quality than plain film mammography. You could change a little bit the viewing criteria on the monitor. It's better to view the calcifications, and the computed assisted diagnosis is immediately incorporated in the image itself. That gives you a helping hand in deciding if there is a mass or if there are calcifications that are sometimes a little bit not too conspicuous. It helps show them to us.
And I think, Dr. Mascaro, you were mentioning too something about you can view them from different locations too if the patient wants to share with their doctor something right away.
Correct. These images will be on our packs, so I can always ask a second opinion of one of my colleagues that's across town.
So you're saying then we don't have to run to a different facility and different doctors to get second opinion?
Absolutely not.
Oh my goodness.
We can always ask one of our colleagues.
Wow.
And we're interconnected through our fiber optic system throughout Western New York, from the South Towns all the way to Lockport and Newfane area. So
Wow.
it's very important that this information is at the fingertips of even the patient's referring physician. If they wanted to take a look and we can review them together, they can be on their computer and we can be on our computer and kind of telling them, this is what I'm concerned about, and I can even circle it and make a little note telling the patient's physician what we're concerned about and what are the next steps on going on to it, and as well as breast surgeons can be able to look at our images on their computers at their fingertips.
Wow, how much time does that save? I can't even imagine.
That is amazing. And another important issue is you don't have to deal with the issue of lost films, because if the film is lost or misplaced, it was a major issue. Now it's no longer. It's all digital, saved on a hard drive, backed up on another hard drive. We can print images if we need to, but we still have the digital format of all the images. So that is great. And as Dr. Mascaro mentioned, you could have a second opinion immediately. Some of our colleagues, we talking to each other and consulting on the same patient if we need to.
Well, as a woman, I pray to God that I never need these services. I know I've used your services in the past and have always been treated with such tenderness and kindness and such a great atmosphere. And all I could think about, God, like I said, God forbid, for breast cancer, having the best imaging equipment available right in the downtown area, and then knowing that in the unfortunate cases where something is shown and you don't have to run around, that is so much comfort that you can get a second opinion without even blinking.
Correct. And Anne-Marie, those services are also screening, not only for women with breast cancer, it's to screen to make sure you don't have, and God forbid if there is, you catch it at an early stage. And this complements our MRI that does breast MRI, and we're equipped to do MRI guided breast biopsies. We could do ultrasound guided breast biopsies. So we're bringing a lot of tools and a lot of modalities available for women's imaging at Western New York MRI.
Wow. And thank you for bringing that up, because I'm just thinking, when I'm hearing you share so much about what you're doing, I'm thinking of how helpful it is in your time of need. But what Dr. Sergani said is really important. You absolutely have to get that imaging done once a year, as well as your female exam and anything else, even bone scans now that you're over a certain age. We're not saying what age. Bone scans are important. All those things are important because you speak to the importance of finding it right away. You save a life.
Well, like Dr. Sergani said, it's very important about early detection and early intervention. To catch something early, be it osteoporosis with a bone scan, to get supplements to build up your bones. Or is it by catching an early lesion in the breast? And it could be benign or it could be malignant, but you have to work it up. And we have the tools here in downtown Buffalo to work up these cases and to provide the information not only to the patient, but to the referring physicians, which is very important on keeping the process going. After we find something, then the next phase is going to a breast surgeon or to their physician, and to get that ball rolling and to get the process going for people to know where to go to the next step.
And I want to remind our viewers once again, too, that you can ask your primary where you want to go. If that even makes sense, you tell them, I want to say where you want to go, but you can ask/tell them where you want to go. Because I always tell that story before I even knew you, when I had a health issue, I don't even know how many years ago that was, and I'm out in the South Towns, and my doctor sent me here. I was like, why do I got to go all the way into the city? It was before I practically live in the city. Now I'm here every day. And this is where he sent me. And so what's important about that is for you to be proactive with your health. When your doctor tells you something, ask questions and say, well, gee, I saw this, and you can request to come here. So any last thing that you want to say before?
In closing, Anne-Marie, I think what's very important here is to get your studies done and to have the lines of communication. Dr. Sergani's brainchild has been our PAC system, and we've built this fiber optic network across the city and reaching as far as Lockport and Newfane and in the South towns, where referring physicians can get the answers to the questions that they ask in the imaging of their patients. So they have them right at their fingertips. So communication is very important, and that's why we take pride in what we've done and what Dr. Sergani envisioned many years ago.
Well, I thank you for investing in the city of Buffalo.
Thank you. I want to elucidate something he just mentioned is for the city of Buffalo. This service is available. So for the women, we just want to make sure that they know that it's digital mammography, the highest standards ever in their hometown. They don't need to travel. They don't need to go through any trouble to get to a place that those services are provided. It's right there in their backyard. And thank you, Anne-Marie, for letting everybody know that.
Oh, you're welcome. It's my pleasure. Thank you both
Thank
so
you.
much. So, Mr. Tony Lyons, we are in one of your treatment rooms, and we found one of your doctors.
Yes, this is Dr. Banzo, and she's one of our key practitioners.